Thank you so much for having me today at this fantastic conference. As you just heard, my name's Luciana Burge. I'm the Labour and Cooperative Member of Parliament for Liverpool Wavertree. I've been campaigning on mental health issues since I was first elected back in 2010. And then specifically in two roles that I've had, I was the Shadow Minister for Public Health from 2013 until last year. And historically, we included mental health within that brief, so looking at it through the prism of prevention. And then most recently, I was the first ever Shadow Cabinet Minister for Mental Health. And I was really privileged to be in that role. I'm now the president of the Labour Campaign for Mental Health, and if anyone in this room happens to be a member of the Labour Party, if you haven't signed up for the email list, please do join. We're always looking for more people to get involved in that very specific campaign within the Labour Party. I am, of course, conscious that I am the only politician with you this afternoon amongst an audience of mental health professionals, social workers, GPs, policy experts, police officers, housing teams, and many more. And I know that I followed Norman. He and I often tag team at events like this. Unfortunately, I wasn't able to be here for his earlier remarks, so I hope I don't repeat anything that he may have said, and perhaps I'll say something a little bit different, and it'll be good to have a conversation about any of those differences later on. I should say that my remarks today are anchored in the fact that, particularly over the course of the past 3 years, I've had the privilege of having the opportunity to travel right across the country and see literally countless projects and services within mental health. I've met frontline professionals, I've met many service users, people of all ages and all backgrounds, including those from specifically from African or Caribbean background. And I should also add that, like Norman, I'm also an opposition MP, but I should say from the start, I don't oppose just for opposing's sake, but I won't hold back from sharing with you, I think, we've got some changes still to make and some progress that we could really be focusing on. I do think it's worth starting with something positive, and I think it's worth reflecting on the fact that we have made some progress in recent years, particularly within the political environment, talking about mental health. And just in the last 3 years alone, I've noticed a massive difference. Since the Time to Change campaign began in 2008, we've seen a tracked difference in the approach to stigma within our country, and I think that's been helped by lots of people in the public eye that have come forward, and the list is getting longer, and particularly in the wake of International Mental Health Day that we had on Monday, some more famous faces coming forward. It was great to see X Factor included within that. People very bravely speaking about their own experiences as well, which we know helps to break down that taboo. In my own time in Parliament, I've seen a number of my colleagues speaking about their own experiences in Parliament in a way that we've never seen before. And as I said, World Mental Health Day has been and was recognised this week by the leaders of all the mainstream parties. Just opposite Parliament, we had the London Eye all lit up. And I think, the more that we can be doing to explain to people that mental illness is not a sign of weakness, we all have mental health, I think the more that we will be able to ensure that people get the support and treatment that they both need and deserve. I think one of the greatest steps forward was what happened in 2012. In 2012, we had the Health and Social Care Act, and we can discuss the merits of that or the lack of merits of that. I'm on record of having voted against it. But one of the few things that we can celebrate, and I think all sides of the House would welcome, is the fact that we now have enshrined in law parity of esteem, equality for mental health. And it was largely down to the work of my Labour colleagues in the House of Lords that put that forward, and it was accepted at a very last moment. Kind of this vital recognition that a person with mental illness should be treated with the same degree of urgency and expertise as a person with a physical illness or injury. Now we know, and I know from listening to many frontline professionals and patients, that real equality, that real parity doesn't quite yet exist. And myself and many others have pressed ministers time and time again. But we are on a journey, and I do believe that at the very least, because we've got that in law, we've got something to aim towards and to achieve. However, we are all here today in recognition of the fact that people from black and ethnic minority backgrounds, especially Afro-Caribbean men, are disproportionately represented in our mental health wards. And I wanted to read a short section of a report to you. It shouldn't take me more than 30 seconds, but it said that black men are being let down by the mental health system, which is supposed to look after them, says a leading psychiatrist. There is a cycle of fear. Everybody in the African Caribbean community knows that you're more likely to be sectioned, in prison, given antipsychotics if you're black, he stated. And he said the problem began in the early stages of mental illness. GPs were more likely to refer black men to a psychiatrist if they came into the surgery looking distressed, he said. This was partly because black men were less likely to see their GP regularly and less likely to have developed a relationship with them. However, attempts are being made to address the system's failings by encouraging black men to seek help early. Now, this was from a BBC report published on October the 13th. Not today, not October the 13th last year, or the year before that, but 17 years ago in 1999. October is Black History Month, and I wish this is something we could have consigned to the history books by now. And the fact is that still in 2016, black African Caribbean men are nearly 7 times as likely to be admitted as inpatients or detained under the Mental Health Act as the average population is. I think it's one of the most glaring examples of inequality and discrimination in our society. We know that people from BAME communities are more likely to be diagnosed with mental health problems, more likely to be admitted to hospital, more likely to experience a poor outcome from treatment, and more likely to disengage from mainstream mental health services. And more worrying still, there's other research that's found that despite there being no evidence to suggest that Afro-Caribbean people are more likely to be aggressive than their white counterparts, staff in mental health wards are more likely to perceive people from this background as potentially dangerous, and this can in itself manifest itself in the level of force, we can reflect on the figures, used to restrain black men. And I think this shows us that still there's something in our mental health services that is still going wrong and urgently needs to be addressed. It's likely that mental health services fail to understand or provide services to meet particular cultural needs. And I think it's something that we should all be concerned about. I know it's something that myself and many of my colleagues are continuing to raise in Parliament. We need to make sure that the services we have in place are accessible to anyone who needs them. And in the same way that mental health doesn't discriminate, our services mustn't either. The previous Labour government's action plan on BAME mental health, it was called Delivering Race Equality. That policy effectively ended in 2010. And again, a number of us have been calling on the government to revisit that and ensure that we've got something up to date. Because we believe that at the very least it should be renewed or replaced. And I think it was telling that in the Mental Health Task Force report that came out earlier this year, they sharply criticised the provision for men of African and Caribbean heritage and found evidences, and in their words, of systematic failure. So in terms of what should be done, because ultimately this is about action, it's not just reflecting on what the very many challenges are, it is clear that there is much work to be done to tackle these very, very specific inequalities and support those frontline professionals and leaders to rethink how they engage with service users from different ethnic and cultural backgrounds. I believe that we need a range of interventions. We need, at the very start, to recognise the mental health needs of BME communities in commissioning those services. We need more awareness and training for frontline staff and more culturally sensitive services. We need health and care services that are linked up with relevant voluntary and community organisations that we know are already doing such a fantastic job in those communities in which they exist. And we need mechanisms through which we can guarantee, and this for me is the most important point, that the voices of BME service users and carers are heard and heard properly all of the time and are able to influence those services, the commissioning and development of them. However, we cannot leave this to our health services alone. We know that our NHS is under an incredible amount of pressure. The figures just out today, in fact, show that there's, in another part of our NHS, there's been a 30% increase in the last year alone for delayed discharges. We know that the system is under incredible pressure. And it's why I'm so heartened to see people today from so many different organisations and professions about how we can effectively do what, the most we possibly can to work together to make that very real difference. One of the biggest challenges that I come up against is the issue around availability of data within mental health, I need that data in order to hold the government to account and then effectively lobby for change. But if without that data, I'm not able to really ensure that that difference comes forward. Earlier this year, I ran a campaign to highlight this gap in data. And I think there is a very specific gap between data we have for physical health services compared to the data that we have for mental health services. I ran a campaign using the hashtag Mental Health Matters earlier this year. I just shared a collection, I've got a whole wealth of them, but just a collection of 30 top questions that I'd asked the government that they were unable to answer. Or when I asked the question, I was told that the information wasn't held centrally. And given the level of inequality that I know is being discussed today, one of the most concerning examples that I shared during that campaign was when I asked about information for services specifically targeted at black men. And the response was from government that they didn't know. I believe that the government has a responsibility to know so much more about everything to do with mental health, but specifically when it comes to BME mental health. In order to implement effective policies, sharing local data strikes me as an area that perhaps people in this room would be able to work on, something we can do amongst ourselves. I've had to, as an opposition MP, had to use the power of the Freedom of Information request to collect data because it's not held centrally, and collecting it from individual clinical commissioning groups or individual police authorities or individual mental health trusts in order to create and collate that national picture. I also think it's important that everyone in this room, politicians included, do everything we can to understand the differences among our communities. And I don't know if anyone had a chance to see the documentary that was aired on the BBC last week. It was called Being Black, Going Crazy. And in it, a number of people from African and Caribbean descent spoke of the challenges that they faced in their own communities when it came to their mental health. It was particularly interesting. It highlighted just some of the challenges. I'd be interested to hear from anyone if they thought that was an accurate and fair reflection. But certainly it raised the challenges around why early diagnosis and intervention, why that is so very important. And if people feel the services on offer simply aren't for them, then ultimately we risk abandoning people until crisis point. And the focus of what I and many others do is, how can we do everything possible to avoid people actually getting into a crisis in the first place? Apart from the devastating human cost, and people will have heard me say this before, I can see some familiar faces in the audience. I'm first and foremost prompted by the social and moral reasons why we should do everything possible to keep people in their families and in their relationships and in their homes and maintaining a tenancy and in education and being able to carry on paying a mortgage. But even if people aren't swayed by those reasons, the financial implications of not helping people earlier on, which is, I don't need to tell everyone in this room, prevention is so much cheaper than cure. We know that the government acknowledges and accepts the figure from the London School of Economics that mental health is costing our economy £105 billion every single year. It's nearly as much as we spend on the entire NHS. It just doesn't make financial sense for us not to be contending with these many challenges much earlier on. So if I can just perhaps end with just a few very, very quick things that kind of more broadly we're looking at within mental health, but very specifically address many of the issues that we're talking about today, about what more needs to change. Integration. Integration is just so critical. We've got a system that perhaps doesn't... Well, I hear on an almost daily basis about the fragmentation that we see in our system, but there's so much goodwill. I know people often want to do everything possible to be working together. We really need that integration to make a difference to the people who are accessing services, because there are still too many stories of people having to go through their stories time and time and time again, particularly within mental health. We need that seamless integration of health and social care so people feel that they are being looked after as a person, not being treated one symptom at a time. Secondly, we need a real investment in our mental health services. I'm doing my very, very best to hold the government to account on the pledges that they've made so far on mental health. We've heard them all, great fanfare, £1.25 billion for children and adolescent mental health services. We were told, and I raised it in Parliament only this week, the Secretary of State for Health, Jeremy Hunt, told us that every clinical commissioning group in the country this financial year would be increasing the amount that they spend on mental health, at least in line with the increase in their overall budget. I've done for the third year in a row an FOI request to each of the 209 clinical commissioning groups in the country, and this year's increase increased. Last year, 30% of CCGs weren't increased in the amount that they spend on mental health. This year, it's 57%. And so there's a massive disconnect from the warm words we hear from government and actually what's happening on the ground. So, we need that investment to come forward in mental health. We need it to happen. We need it to happen now. And we need to also be investing in the staff that are providing these services, in our nurses and doctors that we know are severely stretched. We know that there's many gaps across the country. There's a massive recruitment crisis, and we really need to focus on that for our future. Thirdly, we need renewed funding into research and development into mental health. Again, it's the poor relation of physical health. Just 5.8% of total UK health research spend goes into mental health. And of course, we must ensure that research specifically focuses on BME mental health communities as well. I think that could really make a difference about how we can see our services develop into the future. And fourthly, we need to start with the next generation. We need to start with our young people. I know that our schools are under a lot of pressure, but our schools could and should be doing so much more to equip that next generation with the confidence and skills, particularly when it comes to mental health. I'm part of a campaign that's been going for many years to have statutory PSHE in every single school. It's not just about equipping our young people with the skills and knowledge, but also how they can be developing in terms of their health and in terms of their social beings as well. That's a massive campaign that many of us are focusing on. And just finally, I don't think it can be left to our NHS to fix our nation's mental health. We're just thinking about these challenges through the prism of the NHS. We're thinking about it too late. If we look through the whole life course, there's many services provided within our communities that we know that can make a massive, massive difference to supporting people earlier on. And whether that's our children's centres or our youth services or our befriending services or our drop-in centres, none of which currently largely are not funded by our NHS, but things that we know that can make a real big difference. And it's about making, I think, the financial case for all of those services, about why our local authorities should be supported to keep providing them to make that difference earlier on. I'm going to continue to do my very best to hold the government to account, and I'm very happy to work with anyone in this room that would like to assist me in this task. We rely on people letting us know what's happening on the ground. Unless people tell us, we don't know. And so I'm really grateful for those people that do email in and share their stories, whether that's on social media or via the inbox. It does make a difference. It does mean we can ask those questions that are very specific about experiences on the ground. And I just look forward to working with as many of you as possible to make the difference for all of our communities that everyone in this country deserves. Thank you.